Hello everyone and welcome back to MediInsights. Today we'll explain Apixaban, a commonly prescribed oral anticoagulant, in simple, practical terms you can use. In the next minute you will learn when it's used, how it works, typical doses, main side effects, and essential safety tips to better protect you today. Starting with use of Apixaban Tablet. Apixaban is an oral anticoagulant used to reduce the risk of stroke and systemic embolism in people with nonvalvular atrial fibrillation. Apixaban is also approved to treat acute deep vein thrombosis and pulmonary embolism, to reduce the risk of recurrence after initial treatment, and to prevent blood clots after hip or knee replacement surgery. These are the main, evidence-based uses you are likely to encounter in clinic or hospital care. Next, dosage of Apixaban Tablet. For stroke prevention in nonvalvular atrial fibrillation, the usual dose is 5 mg taken orally twice a day, and the dose is reduced to 2.5 mg twice daily for patients who meet specific criteria. For treatment of deep vein thrombosis or pulmonary embolism, the recommended regimen is 10 mg twice daily for the first 7 days, followed by 5 mg twice daily. For deep vein thrombosis prophylaxis after hip or knee replacement, the usual dose is 2.5 mg twice daily, started 12 to 24 hours after surgery, with duration determined by the type of surgery. Always follow the prescribing information or your clinician's instructions for exact dosing. Next, mechanism of action of Apixaban Tablet. Apixaban works by directly inhibiting factor XA, which reduces generation of thrombin and prevents clot formation. Because it targets factor XA, Apixaban shortens the cascade that leads to fibrin clot formation without directly inhibiting thrombin itself. This mechanism explains why it is effective for both stroke prevention in atrial fibrillation and treatment or prevention of venous clots. Next, side effects of Apixaban Tablet. The most important side effect is bleeding, which can range from minor bruising or nosebleeds to serious, life-threatening hemorrhage. Other common problems can include anemia or gastrointestinal bleeding, and allergic reactions are possible but uncommon. Apixaban is contraindicated in active pathological bleeding, and clinicians monitor for signs of blood loss and consider reversal agents if major bleeding occurs. Next, important advices for using Apixaban Tablet. Take Apixaban exactly as prescribed, twice daily at the same times, and do not stop it suddenly without medical advice because abrupt stopping can increase clot risk. Tell any clinician or dentist that you are taking Apixaban before procedures and report any unusual bleeding, sudden severe headache, or fainting immediately. Be aware of drug interactions. Strong combined P-glycoprotein and CYP3A4 inhibitors or inducers may require dose changes or closer monitoring, and dose reduction rules apply in older adults, low body weight, or reduced kidney function, so always confirm dosing with your prescriber. Thanks for watching. If this cleared up Apixaban for you, please leave a question or experience in the comments, and consider subscribing for more clear medication guides. Always check with your doctor before making changes. Stay safe and informed today.